Good afternoon, everyone. My name is Jerome Fletcher, and I want to welcome you to the Economic Revitalization and Recovery Town Hall. On behalf of County Executive Mark Elrich, I am an Assistant Chief Administrative Officer in the Office of the County Executive. And we want to talk to you today regarding things as we see it going forward in economic recovery. And we have got some great guests today. This is the very first meeting of this particular format. This format is a little different from our economic recovery work groups that you all have participated in. The audience of this town hall are the three active work groups that we have right now. They are the small business work group, the restaurant and retail work group, as well as the hospitality work group. What we are doing is we're trying to communicate some great questions and answers to you, knowing that you have concerns about where we're at and where we're going, and you're not the only one. We are concerned as well, and we want to make sure that we try to get you information on a very timely basis. Hence this new format. The new format is designed to communicate a lot of good information all at one time. So we're going to get right to that. There are three work groups, as I said, that are still active right now, and getting this information to you has been done in the form of receiving a question and answer in advance. So we did receive several questions in advance that we're going to go through. We're going to ask Dr. Gales, Dr. Stoddard. Also, we have Sylvia Kent, who is the chief of the Division of Labor and Public Safety in our legal office as well. So she is here to make sure that we get information as accurate as possible as well. I cannot stress to you the thanks I want to give those three people in advance. Their time is extremely valuable, and the information is even more valuable to the audience that we're trying to get to. So while we are talking and going through some of the answers, I want to encourage you to put questions over in the chat. Staff will be monitoring them as we go through this exercise. There may be some that can be answered before we get to the team format, which is going to make it all the better. This actual town hall is being recorded. By that, I mean there will be a link that will be live for it for the next 90 days. So it will be able to be referenced back to for those of you who need to refer to it for information. Let me start by talking about the new executive order that was effective November the 10th at 5 p.m. We submitted the order last week, and council did pass it this week with a few caveats. And most of you know that this executive order affects restaurants and the capacity. We've rolled back some of our relaxed activities based on where our numbers are, and I definitely won't get into all of the numbers, but just to tell you that we are at a position that is trending in the wrong direction. You know, our cases and our numbers are going up and higher, and it's not just alone with Montgomery County. This is cases and increases in numbers that are affecting our peer jurisdictions, it's affecting our state, it's affecting our country. So our goal with the restrictions is not to hurt the economy. Our goal is to keep as many people safe as possible. You know, this being a public health safety pandemic, we have to remember that we are trying to keep as many people as safe as possible, and balancing that with an economic development lens of being able to allow as many activities as safely as possible is a very, very tricky situation. So again, that's what I thank the doctors for what they have done. And what you may have heard is that, you know, our peer jurisdictions and even our own county executive has talked about going even further to reduce some of the activities. And I think if you have attended a lot of the work groups, you know that as we get information, we try to bring it to the group so that we can prepare you, and you can then prepare in advance of how to react and respond to this information. We are always looking at our numbers, and I would say that the restrictions that we have that were just introduced will probably get even tighter if our behavior does not change, and that is just a reality. One thing that I can tell you about in the spirit of transparency and clear conscience is the executive wants to make sure that not only do our restaurants adhere to the contact tracing criteria of getting names and information, we want our fast food establishments where dine-in is available to do the exact same thing. So we're working on the messaging of that. We don't want to single out any particular restaurant, so those in the fast food industry are going to be susceptible to this requirement as well. And we believe that doing this and allowing more information to be gathered will help us in the contact tracing as it relates to people actually getting cases and us needing to react to it in a very swift manner. So please be on the lookout for that information as well. So what we are going to do now is I am going to go to the questions that we received in advance. And as I do so, it will allow us to have a conversation, and we'll ask the other panelists that I referenced earlier, Dr. Gale, Dr. Stoddard, and Ms. Kinch, to actually chime in to provide answers so that we can give you what you need. So a couple things I want to just clear up with the new executive order as we get into some of the questions as it related to our discussion today. We were not reopening new items. We were not reopening outdoor, arts, humanities theaters or indoor arts, humanities theaters that were not already previously open. They are not subjected to the 25% capacity rule because they are not an allowed activity. These activities were deemed to be on the riskier side of the activities for the county. And let me be clear, these are not activities that Dr. Gales and Dr. Stoddard determined that they were high risk. These were activities that had always been laid out in the governor's order of what was in phase 1, phase 2, and phase 3. We could never get out ahead of the governor in our reopening activities, but we have always consistently trailed behind him. Based on his press conferences and information this week, I believe you'll notice that he is actually coming closer to us. And that doesn't mean that we're thrilled that he's coming closer to us. It just means that more people are getting in better alignment with our views of what is being deemed as safe and what is being deemed as more risky. And those activities that I just mentioned are on the riskier side. Another thing I want to clear up is the definition of a gathering. And, a gathering is a group of people who are in a specific location for a specific reason. The reason why restaurants don't qualify as gathering and they are subject to a 25% capacity rule is because we provided specific guidance for restaurants to allow them to occupy their space safely. The 25-person rule does apply to others who gather that are not in that restaurant setting. So we do want to make that clear and understood. And if we have any more questions regarding that, we'll be happy to answer them as we go on. So having said all that, let's get to some of the questions and get some answers here. The very first question is Dr. Gale, Dr. Stoddard, and I will leave it up to you guys as to who wants to answer this. I have a feeling this is a Dr. Gale's answer is, can you discuss the science that you're relying on? I know that there was a chart that was submitted and posted publicly on our website that sort of shows the numbers that the numbers that you're tracking in order to sort of guide the county on where we are as far as our ability to relax our activities. And I will be the first to say that I know wholeheartedly that we are 2 or 3 times worse than those numbers on that chart in order for us to get to a place of reopening. But I think the group would love to hear your discussion on the science that you're relying on.
Good afternoon, everybody. Thank you for the opportunity to be with you all. To remind folks, the numbers that we're looking at are the same numbers that we introduced back early on during the early stages of the pandemic. There's a little bit of echo. Is anyone else hearing that? Okay, I'll keep talking. Okay, sounds better. So the data that we're looking at and the measures that we're looking at are identical to what we introduced back in late May and early June before we reopened any of our provisions. We simply, about a month ago, reframed those and hopefully made them in a way that was more digestible or easily digestible for the folks at home in terms of how it's presented in the dashboard. The criteria that we're looking at in terms of primary criteria, again, are surveillance-based data, rate of transmission, which is the R0 value, the cases per 100,000, and so that was changed a little bit. Instead of just reporting the daily case total, but looking at the cases per 100,000 and the test positivity rate. The secondary criteria that we look at that influences things includes our hospitalization data, including utilization of acute care beds, emergency room, intensive care units, as well as measures that tie to the effectiveness of our contact tracing apparatus and the ability to follow up and identify cases that have tested positive and identifying contacts secondary to that process to identify folks as quickly as possible to get them tested to, again, interrupt any future potential transmission by getting them to know their status early on in the process. Now, we also broke these down utilizing criteria from the CDC, as well as looking at other jurisdictions who have created similar frameworks. I'll be very candid that, again, part of the challenge is we did not and we don't have any state guidelines to influence this. And so we have had to look at other jurisdictions, including Washington, D.C., New York City, Chicago, Boston, and the state of Massachusetts, just to name a few, in terms of coming up with different categories in terms of how to determine what those particular levels are and the risk of transmission associated with each of those comparable levels.
All right, thank you, Dr. Gales. That was an excellent response as always. If we stay right there on the numbers and the science, there was a couple of questions that we received regarding the air quality or the air standard, and wondering if restaurants have a different air standard than maybe retail, and that affects some of the decision making as it relates for restaurants.
So yeah, I can speak to that a little bit. So first off, you're going to see later this afternoon, we're going to post some additional guidelines on ventilation and filtration. They're just being finalized and will be posted on the web today. We consulted with experts from the National Institutes of Standards and Technology, NIST, as well as a couple local companies who do HVAC consulting, and have provided us feedback on what they have found to be effective in terms of increasing ventilation and filtration. As it relates to the question that Jerome has asked, or Jerome has, I guess, shared, yes, there are different standards for different businesses. Those are set forward in our permitting service code. For restaurants, the air exchange rate, the amount of outdoor air required in those facilities is generally higher than those for theaters and other locations, largely because of the cooking nature in many restaurants. And so they have, given the cooking that goes on those facilities, they have to have a higher air exchange rate in their dining areas as well as in their kitchens. And so that does impact the overall requirements in terms of what can be allowed and what cannot be allowed. And that's a standard that has existed long before COVID and is linked to the permits to operate a facility. And so obviously those do impact, and ventilation is important. I will say ventilation is, aerosol transmission of COVID-19 is definitely a big portion of its transmission, but the majority of the transmission is close contacts less than 6 feet. And so doing ventilation is not a substitute for limitations on people indoors, but it is certainly a support to reduce a risk within a facility.
Okay, thank you, Earl. Dr. Stoddard. Also, let me ask this question, and that was very helpful. And then before I ask the question, let me just say that our next meeting we plan on having on the 20th, a week from today, we will have some air and filtration experts with us to sort of talk about that more with the group, so that we can get into some more of that science of trying to make sure that we actually prepare and use equipment properly to get us to where we're trying to go, as Dr. Stoddard said. Let's talk briefly regarding the rollback of the logic behind shortening the hours for serving from midnight to 10 p.m. Can we get a little bit of conversation on that? We do know and recognize that people are going through challenging times, and I hate to sound like a broken record, but I know we're trying to balance that protecting health and reducing the spread of the virus with recognizing that there's an economy out there that's hurting pretty bad. And after we fully recognize that, we still must do what's in the best interest to keep everyone as safe as possible.
I can start, and you can add on, Dr. Kells, if you like. Across the country, bars have been recognized as one of the higher risk locations within for spread of COVID-19. This has been borne out in a number of studies, both from the earlier waves of the pandemic in Europe and elsewhere. What tends to happen and what we've seen through our enforcement activities is that compliance with the physical distancing and the face covering requirements tend to get more lax as people consume alcoholic beverages. And so the later in the evening, when we were doing enforcement throughout the event, what we've seen is within the same restaurant, we would see compliance at 7 o'clock and we'd see a deterioration in compliance at 10, 11, and 12 o'clock as people transition from consuming food to consuming more alcohol and less food. And so because the county does not have separate distinct bars that are operating just as alcohol providing establishments, they're all required to be restaurants as well. It makes it more difficult for the county to differentially regulate those places that are operating as bars. And so the best way that we could deal with that is to try and eliminate the bar-like atmosphere that is created the later in the evening based on our own compliance and enforcement efforts. And in fact, you'll see actually many places around the state are similarly putting in measures to limit bars because we don't have that distinction in Montgomery County. Our ability to limit them has to be more nuanced.
All right, understood. Thank you, sir. Let's move to some of the outdoor questions now. Fitness centers. Does the new executive order apply to fitness classes that are held outdoors?
Yes, so the rules in terms of gatherings and limits and all those do apply across the board for indoor and outdoor activities. And the expectation is that the outdoor classes would adhere to the same rules as previously prescribed by the executive orders.
All right, understood. And so, can outdoor drive-in movie theaters continue to be held with 50 cars? I believe that answer is yes, if I recall correctly. Yeah. All right. So there is another question on outdoor. A 25-person limit for outdoor sports makes nearly all sports impossible to play. Can you provide the rationale why indoor spaces are provided more capacity than outdoors? If you haven't already, if there's anything else you want to say about that, that's fine. Otherwise, I think you gave your point that we had to adhere by the rules, but.
Yeah, it's across the board. Indoor, we're not discriminating against outdoor versus indoor. It's the same requirements in terms of capacity. And honestly, if anything, the indoor facilities may actually, there may be stricter requirements in terms of capacity depending upon how the numbers move forward. And so we have said all along, if there are programs that have procedures and policies in place to adhere closely to the guidelines, particularly as it relates to the capacity, we welcome those if you'd like to submit those for review. But again, let's be very clear, and I don't want to sound harsh on this, but the reason why we're putting in these numbers and these restrictions is the fact that our cases have doubled in the last 10 days. And we're trying, I don't know how else to put it. And it's not the instance of one activity being exempt from it. We're seeing widespread community transmission, where right now we're seeing cases pop up as a result of sporting activities. We're seeing cases pop up as a result of indoor and outdoor restaurants and retail. We're seeing cases pop up as a result of childcare centers, schools, houses of worship. Unfortunately, we don't have a set, culprit to say, here is the source, and we can go and identify that and put restrictions on that. It's widespread transmission, and so that's why the guidance has been, widespread and diverse in terms of the different things that we are putting restrictions upon. The goal is hopefully that by putting some restrictions but not closing things down entirely, that there will be an opportunity for businesses to continue to function in some capacity without, and at the same time drive the numbers down so that further more restrictive actions, won't have to be recommended or put into place.
And if I could just add to, actually, I was looking for the link to provide the letter of approval process. And so we are, as Dr. Gales alluded to, we have already done this for a couple sporting activities. If, for example, to play a soccer game, you needed 28 people instead of 25. I don't know what the actual minimum number is to play a soccer game, but we have considered those, particularly if you have offsets, to make things safer, like additional spacing, or some programs have done some testing for tournaments and things like that. We have entertained those. I do think I'll go a bit further than Dr. Gales does to say that we're in a very tenuous time. So what's going to happen over the next 7 to 10 days is we're going to be really monitoring what happens after the implementation of this first round of scale backs. And Dr. Gales was very intentional in his recommendation not to close anything down in this first round, but rather to limit the number of people participating in things. It is entirely plausible to believe that that will not be sufficient to curb the spread of the COVID-19 expansion that we've seen over the last several weeks. And if that proves to be the case, the next round of things will include things being closed down. And we don't want to go there. That is not, suffice it to say, we know how impacted you all are. Dr. Gales and I and everyone responding to this is frankly tired of it. No one wants to move forward with it. But in order to curb the spread of the disease, other jurisdictions have canceled youth sports, to be clear. There are jurisdictions in the state of Maryland who have moved forward with that. We have not gone that far yet, but if we do not see the 7 to 10 day change that we're hoping to see, that may be included in the next step. So while we're looking for some accommodations in the short term, just recognize that 2 weeks from now or 3 weeks from now or after Thanksgiving, the conversation may shift a bit more.
Thank you, Dr. Stoddard. So one other thing that is a huge issue is, when we talked, myself, you guys, when you came and visited some of our work groups in the summer, there was a good sense of collaboration going forward on some of those groups being involved in how we move forward with what should and shouldn't be open based on their subject matter expertise. I feel like I'm asking this question, but hopefully I'm not answering it at the same time. I feel like now that we're going in the other direction, that opportunity for collaboration as things are moving so quickly, what I would say is Dr. Gale said that the cases are going up so rapidly, and our position is we're moving backwards and not forward. Is there an opportunity to partner and work with those particular stakeholders in those work groups as you develop your new guidance going forward, instead of them being reactionary to the guidance as it's presented?
Well, again, I can only speak from providing health guidance. I'm not in the business world. And the factors that we think about in terms of the activities that are allowed or permitted are strictly driven by the health information and the surveillance data. I think that there are opportunities to collaborate and think about, for example, some of the work that has been done in the entertainment field to say, when we reach certain metrics, here are the types of provisions that need to be put into place in terms of how businesses can move forward and successfully reopen that meet the public health guidelines and meet those safety parameters, but at the same time allows for those activities to move forward. But when it comes to, again, providing the health guidance, when we're seeing emerging data in terms of trends that are showing cases increasing significantly and folks being impacted, we rely on objective criteria and data to inform that process. I think there again is we sit in this time period while we're waiting to see what will happen in terms of these first step or set, or however you want to talk about it, of restrictions, to see what impact that has on the numbers. I think there are opportunities for the work groups to continue to talk about what those parameters look like. But the reality is that, when it comes to us on the public health side, we're thinking through what the data shows us and what the clinical data is showing us in terms of how we move forward with those decisions. I think it's a separate conversation. So that is what's going to continue to drive the recommendations from that perspective. But I do think there are opportunities to look at and say, how will these particular actions impact businesses if those steps need to be taken, and to think proactively about what steps could be taken to address those concerns or tweak those concerns so that if those things move forward and those steps have to be taken, there are some strategies in place to discuss how businesses can pivot. Alternative structures can be put into place to still be able to practice and perform their services as much as possible. But I think it's a very careful line between bringing in, factors that aren't, again, data and clinical information to guide the public health guidance part of that equation.
Okay, thank you, Dr. Gales. Appreciate that response. The next one, and I think we're going to just transition to a little bit of clarification on a couple of items. And, this one is about, indoor ice skating versus outdoor ice skating. I believe indoor ice skating remains closed. Someone correct me if I'm wrong. And outdoor ice skating is subject to the gathering and size requirement. Is that correct?
Indoor ice skating follows the guidelines established for fitness centers, and that is that they're not open skate. They have to be part of a practice or other, activity associated with indoor fitness, as opposed to open skate and things like that. The outdoor, we allowed for that differentiation as part of this executive order, so that they could follow the gathering requirements, as opposed to, they're not an indoor fitness center. That is.
Okay, sounds good. Thank you, Earl. Dr. Stoddard. Just out of curiosity, Dr. Stoddard, has anyone talked to the Montgomery Parks and their opinion of the outdoor skating and how they could allow it to be performed safely and then sort of increase that volume, or is that just not a consideration right now based on where we're at?
I haven't heard from them. I mean, obviously, just as Dr. Gales alluded to, we are happy to receive letters of approval for other activities, and we'll take them on a case-by-case basis based on the nature of the activity being described. Okay. But I mean, again, I think we should just be very crystal clear about just how tenuous our situation is right now. We're, the answer I give you today about a letter of approval for expanding ice skating may be very different in 2 weeks once if we need to further restrict. And so I think it's just important that we understand we're in as precarious a situation as we've been at any point in this pandemic. Conditions now are worse than they were, as far as we can see, than they were in April for a host of reasons that we could talk about. But we're in concerning territory.
Yeah, agreed. And I don't think we can say that enough, but thank you for reiterating that. Clarification on Montgomery Parks, the general operating requirements for their signage. I believe that we were asking them to post signs for all 276 playgrounds, which would be costly, and then having the visual noise of those signage being up on all 276. Can you clarify what exactly the requirement is for the playgrounds and the signage that is necessary for them to operate safely?
We pulled that requirement from the final executive, so they're not required to post. We would encourage them certainly to make people aware via social media or their website, but we remove the requirement to do the posting at their parks as well as any other parks that are in the county.
Okay. Understood. All right, so let's keep going here. These are more health-related questions, at least the next couple. Does the county have a sense yet of the long-term health effects of our orders, domestic violence, substance abuse, increasing the education gap between the haves and have-nots? It seems like the question is tailored towards the negative effect of us restricting activities could be having a a complementary downside as well.
You know, again, I'll just be very candid with this question. The other opposite side of this is, you know, we're also seeing hospitalizations and deaths. So we're looking at this angle from lots of different perspectives. We don't have the opportunity to pick one side and look at that. So yes, we are very well aware that because of COVID, not because of me, not because of Earl, not because of COVID has put us in a situation where our backs are against the wall and we're experiencing these things. Let me be clear though, the education gap was present before COVID. Disparities in outcomes were present before COVID. Issues in access to medical care, particularly related to behavioral health issues, was present before COVID. Now, COVID has exacerbated a host of those situations and made those things worse. But at the same time, it's also the balance of if everything stays and remains open, how many people will we have in the hospital and how many people will we have dying as a result of infectious disease? Now, one of the big issues that we've actually are working closely with our hospitals on, in addition to surge capacity, is we have seen an increase in domestic situations. We've seen an increase in pediatric and adolescent mental health concerns. And again, building upon the infrastructures in place, we're working to address those things. So at the same time, while we know that's present, we also have to put in restrictions to keep people safe, because we've seen that when we've opened things up, we've been hit by the freight train, whatever, you know, metaphor you want to put into place. So, you know, forgive me if I did seem a little harsh on that answer, but yes, we are aware of all of those different components, and all of those different things go into consideration when we put in guidance. As Dr. Stoddard mentioned, we don't want to have to do this in terms of putting things in, but simply we have to provide guidance that's responsive to the case numbers. I think part of the challenge is if you'll permit me a second, indulge me a little bit. I think unfortunately at some point in the pandemic, there has been this narrative created that public health guidance is counter to business interest in economic growth and recovery. And that's just a faulty narrative. I think that, you know, we have a job to do in terms of putting forward guidance to keep people safe and keep everybody, you know, safe, alive, and healthy. And I think the challenge has been, there have been some failures in terms of, particularly from a federal response, in terms of being able to pass financial support bills and things like that to provide additional funding to support businesses. You know, and I am not a business owner, and I sympathize. I can't speak from that experience or shared experience, but I think a lot of that anxiety and that frustration needs to be answered by our elected officials at, you know, multiple different layers, particularly at the federal level, in terms of providing that support, given that we have an infectious disease that's causing all of this and our need to respond, but also being able to step up and again be able to address the needs of the businesses who are providing the services that we need so much.
I would also give you one highlight that I think illustrates the complexity of what we're dealing with. We have seen an increase in overdose related deaths, and one might say, well, is that related to the economic anxiety or other mental health concerns that are being raised? But actually, if you look at the period where we saw our levels of opioid deaths increase, and this is not just the Montgomery County thing, this is a Maryland, state of Maryland and elsewhere issue, it's actually during the peak of the hospitalization period for COVID-19. And we were seeing a reduction in people with opioid-related illness going to our hospitals because they were afraid of what was going on at the hospitals, and it may have directly contributed to their death from an opioid overdose because they didn't seek the care that they needed. And so it is a complicated mixture of things that's going on with COVID-19. And I think one of the key things that we're particularly concerned about is, as we see the cases surge, we're seeing hospitalizations increase. And you know, we're lagging what's being seen in Europe, and we're lagging certainly what's being even seen in our northern more states like Wisconsin, Minnesota, North Dakota, South Dakota, places that are a little cooler than we are right now. But they're seeing the surge in hospitalization. And the thing about the surge in hospitalizations is you're not going to see just an increase in COVID-related deaths. you start to see a increase in deaths from all causes, meaning if you got in a potentially fatal car accident today and went to the hospital, you would get a certain level of care and very likely survive. But in the peak of hospitalizations for COVID, the concern is that they're so stretched thin that things you might have survived from, they're not COVID driven, you may not survive from. And so that's the incredibly concerning part that we're seeing in other places in the world. We know where we are relative in our expansion as to where they were, and that's the concern that where we're going.
Someone's dog is happy.
All right, thank you. Thank you.
He's not happy.
Thank you both for that answer. It is a very complex situation, and I think that we all have to just recognize that. And I think that that question is just an example of it's easier to accept something when you can put a face to it and say, well, this is on you, when it's really the public health crisis that we're all just trying to get through and do better with on a day-to-day basis. But it's just hard for people to get in line with that. But thank you for both of your responses on that tough question. If there's a good question in here, this might be it. So when a vaccine becomes available, will the frontline hospitality employees be required to have vaccinations? I think this question was generated from a hospitality business owner who was getting questions for something an event that may happen next June. So if a vaccine is available, will that hospitality employees need to get vaccinated in order for him to actually have, the different events at their venues? And I truly recognize this is a looking down the line sort of question. So is there any thoughts that you have that you might say, well, who does need to get vaccinated from an employee standpoint at this point in time, or is that a little too early for that conversation?
No, it's an excellent question. It's a great question, and they're all good questions. These are all tough questions because these are all tough times. So, just to make sure to hammer on that point. As folks who've been following along at home, there have been lots of different timelines that have been thrown out for successful vaccines. At this point, the one that has been at least publicly announced to show the most promise is a vaccine that's being manufactured by Pfizer. Based upon what they've released so far, it suggests that that particular candidate could potentially be disseminated beginning towards the end of the year or early next year. So even in the absence of knowing definitively which vaccine or which vaccines will be utilized to move forward, we have been working for months to develop a local and a regional plan that builds upon and is in concert with the state distribution plan that is a part of the larger national framework. And in the meantime, there have been priority groups set up in terms of how the vaccine will be disseminated to the general public. If you go online, or we can send you all a link to this, the National Academy of Medicine actually completed a report that breaks down and highlights the 4 priority groups. The first group, 1A and 1B, is focused on, first line responders, healthcare workers, those who have significant medical histories, as well as older populations, and then moving through to phase 2, more essential employees covered in that, including teachers and others with medical conditions. Phase 3 would be, or priority group 3 would focus, in addition to those others, bringing children into the mix. And then the 4th priority group would be just the general public, otherwise healthy adults. And so as things continue to move forward, I think there will be more clarification in terms of, if certain employers will require the vaccine for their staff to come in when they're working. Those details are being worked out. So I would say for that particular entity to continue to watch out as we get more information and the details get firmed up a little bit more, that type of information will be rolled out.
And thank you, Doctor. And what about it, to your knowledge or your opinion about, will there be a religious exemption for like the hospitality staff who do not want to get vaccinated? I remember in Virginia, the top health officials said that once a vaccine was going to become available, they were going to mandate it for everyone. And then the governor came back and said, not so fast, and walked that back and said that's not the case. What are your thoughts on the exemption ability from a vaccine as it becomes available?
Well, I think on the surface,
Yeah.
Yeah.
I can answer that.
Oh.
Yeah, go for it.
Thank you. So the EEOC has put out guidance regarding vaccines and the mandatory nature of them, regarding employers mandating employees receive a vaccine. They've indicated that they believe that there will be a religious exemption. Obviously, the onus would be on the employee to explain why, but there is guidance that's been issued by the EEOC on that. And obviously, any business that has a question as to how this would particularly impact them should seek advice from their own counsel.
That was so beautifully said. Thank you.
Thank you. Thank you.
Love it.
I concur. Thank you, Sylvia. I appreciate that response. Next question is, will the county allow political protests or rallies over 25 people? And we asked this question knowing, I think we've all heard that there's going to be potentially several protests or different groups on the side of the same protest this weekend, maybe in the district. So what will the county allow for political protests in excess of the 25-person gathering limit that we have currently in place?
It's a challenging issue, for sure. Jack Dale's go ahead.
Well, I was just going to say it's very challenging, and we continue to review. Certainly we stand for and support the First Amendment right for people to, freedom of speech, and we also, reserve the right to ensure that practices are put into place and adhered to in terms of as best as possible. In terms of minimizing any potential, disease transmission in those settings.
And obviously, we encourage anyone who will be coming to a political protest or rally this weekend to socially distance to the effect that they're able to during the course of that protest or rally, and also to wear a mask.
And we've been consistent about that. We've obviously had, a number of protests over the summer. We also had supporters of President Trump outside of Walter Reed while he was staying there, and have generally followed the same principles there, which is to encourage face covering and distancing while balancing the First Amendment right issue there.
All right, thank you. Well responded. So that is the last question I have on my list. I'm looking at the chat, and unless I'm missing something, I don't see any questions in the chat for the team right now. If anyone has a question, or if Ellen, if you're watching and I forgot a question, please remind me now. But I don't see any more questions. While we wait for any more questions, was there anything that maybe did not get discussed that you guys want to share with the audience? I cannot stress enough what you guys keep echoing about these being some very turbulent times, and I know that we're headed in a direction that is more restrict than less. But if there's anything else you want to say, I'm sure the audience would love to hear from you guys.
Well, I mean, to echo everything that's been said, is that we are in a tricky situation right now where the numbers stand. And interestingly, when you compare looking across the state of Maryland, and again, this is in no way, shape, or form commenting on a negative or positive way, the counties that are being hit hardest right now are counties who had gone further in terms of reopening versus where we stand. And the reason why we've continue to underscore why we've taken what some have viewed as a more cautious approach than the state and other places, is recognizing that we continue to have a higher, even though it was low, it had dropped from where we were. we plateaued and we still had what we perceived to be too high of a reservoir of virus circulating within our community. And you see what happened now. Our numbers are increasing. I know Baltimore County and PG County today actually had over 300 cases reported in each of their jurisdictions. We're sitting in the lower 200s. So there's following all of these trends and looking at the data, the surveillance and clinical data, and recognizing we also understood that we were going to get a fall/winter increase in cases. All of those factors have gone into how we've provided guidance in terms of how we move forward. I know at times it hasn't seemed the most palatable from a business and economic standpoint, but that's why we've provided the guidance that we've provided. And again, our effort and intent in providing this first wave of guidelines was to hopefully try to keep as much open as possible with restrictions in place to again be able to have some sustained response, to get the numbers turned around in the opposite direction, to prevent there from having to be much larger scale closures that would impact a host of businesses across the board, which is what we don't want to see happen, which is again why we put this first wave of restrictions in place to again try to have some benefit from that. I think that there are, in spite of what may seem like, oh my gosh, here's doom and gloom again, there are some promising signs on the horizon. For example, the fact that there is a vaccine that could legitimately be distributed within the next 2 to 3 months. That would be a significant game changer, because part of the big effort from public health is it's protecting everybody, but really also protecting those who are most vulnerable in our community, whether that's your medical condition or your age and all those other factors. And because of the way that the vaccine is going to be disseminated to priority groups, the quicker and sooner we can get it and broadly available to those who are most vulnerable, it allows us to breathe a little bit easier in terms of being able to open up things, because we know that there's an increased level of protection around those who we know that if they catch it are more likely to have a more complicated course and potentially a COVID-related fatality. So I say all that to say that we're making great progress. We got a ways to go, but there is promise in the very near future. But we have to, in the meantime, stick to the provisions that have been put into place, to hunker down, in the words of Dr. Fauci, hunker down and ride out. I used this example earlier. I'm a tennis player. We play best 3 sets out of 5. We're at the beginning of what hopefully is the 5th set. But when you get to the end, or you're at the end of the marathon and you've got 5 or 6 miles to go, you see the finish line. It's in the future, but you are exhausted. You are tanked. You are fatigued, but you still got to summon it and grit through and get to the finish line. And so, again, this is tough. I can't begin to imagine the economic realities that you're facing, but I do want you to know that we are trying as best as possible, again, to provide guidance that is keeping you and your family safe as much as possible.
Thank you, Dr. Gales. And I did find a few questions. I was in the wrong chat room, but there are a few questions in here, some of which I think we've already answered, but I'll go through them. And if you guys want to just comment, if we haven't already answered, that's fine. And we'll make sure we keep it moving, keep it timely. So the governor is allowing arts and theatrical activities even within their rollback. It is not clear why the county considers them a riskier activity than eating without a mask or other allowed activities.
So let me be also clear. Yes, there are times where the governor has done things differently from us. But we continue to respond to the data and information that we have available. And so it's also important to note that even in the setting of, for example, today, the state of Maryland had the highest daily case total, period. And let me repeat that. Throughout the whole entire pandemic, the daily cases that were reported today was the highest daily total, period, ever for COVID-19. We don't have any guidance or any limits on social gatherings and things like that many of the local jurisdictions, including the big urban counties, the smaller counties out in other parts of the state that have put in those types of restrictions. So, while I respect the fact that the governor has to govern the entire state, the health officials across the state have sounded the alarm and have put in restrictions that curb those activities, and we'll continue to do so.
Wow, that's something. All right.
And I'll just add, and so this is incredibly hard. We did a lot of work with the theaters, and we really appreciated all the work that they did with us to try and get to some safety conditions where, we were very close to moving forward. But the reality of the situation is, particularly for the theaters, it was a phase 3 activity. The governor moved to phase 3. I don't think the results of him moving to phase 3 have borne out that was a particularly wise decision, given what's happened with COVID in the state. Now, the other challenge is that we see where we're going, and we're concerned about where we're going. And so if we had permitted theaters to move forward and then turned around in 2 or 3 weeks and closed them down, we didn't view that as being a particularly reasonable or kind thing to do, given that you would have invested lots of money to do things, and then we would be shutting you down before you actually got to do the performances that you are setting up to do. So it was, to be clear, there's a part of this is the fact that, the writing, I don't want to say the writing's on the wall, because we the general Montgomery County residents control a lot about our own risk. But if we are like in any way any other state in the country at this point, in 3 weeks from now, there's certainly a non-zero chance we're talking about shutting down more indoor activities.
Right.
And I think we're trying not to, number one, create unfair expectations from people, but also trying to be very candid and lucid with people about what is going to happen over the next 3 weeks. Unlike, I think the one activity we included this time was escape rooms, which were 6 people with reservations that they could move forward nearly immediately on. Whereas I know the theaters have said, you guys need essentially a 2 to 3 week lead time minimally to be able to get a show performance up and get tickets sold and scheduled and all those things. But if we gave you that 2 to 3 week lead time with this executive order and then pulled the rug out from under you in 2 to 3 weeks by shutting down a bunch of activities, I don't think that would have been fair to you either. And so this is incredibly hard. Like I said, we invested a lot of time. I knew you all did as well, to move forward with these theater proposals. And again, I would like for us to have been able to include it, but at the same time, seeing where things are going, it was just going to be totally unfair to you all to do it and then pull the rug out from under you later.
No, good point. A couple of other questions. This one is about private schools. Will private schools have to adhere to more stringent rules? I'm not sure if that is a question we can answer. Or... No?
No.
Okay.
Yeah.
All right.
I think we would like to opine on this much more than our attorneys tell us that we should. But I will say that the governor's guidelines are fairly clear about where schools would be guided to go, and that is our case rate in Montgomery County exceeds the 15 threshold that is laid out in the governor's guidelines. Our test positivity is pushing the limits of the 5%. That is the minimum necessary standard for that side of the equation that's on the governor's chart. And so because you needed both of those things to really move forward with hybrid education, the governor's guidelines do not currently support hybrid education in Montgomery County. But for reasons that we do not control, we cannot go beyond. The governor's taken away the ability of local subdivisions to make different rulings on school as they can in other areas. So that's where.
Understood. We're under 10 minutes here, so we might have to do this a little bit rapidly. But the next question is, if a restaurant has 5 employees, are they included in the 25 people, 25% total? I believe that answer is yes. Correct.
They're included in the 25%, yes.
Yeah. This one's a little bit lengthy, but since they took the time to write it, I'm going to take the time to read it. All right, it says, thank you for all of your hard work and dedication to keeping Montgomery County residents safe during this difficult time. We appreciate all of you very much. The governor has allowed indoor performances and film screenings, but the county has not. Can you help us understand how indoor dining, bowling alleys, escape rooms, tattoo parlors, indoor sports, and salons offer less risk than the arts and humanities? Can you help us understand why we cannot have equitable safety measures, including air exchange rates, filtration, distance, and PPE that are applied across all in-person indoor businesses rather than sector-specific recommendations? I'll stop right there because it keeps kind of going. It keeps going into really the perceived equity between arts and humanities and other business sectors. Now, again, I think I said kind of early on in our meeting, these type of activities were deemed in the higher risk category than some of the other ones. So, but I will stop and see if there's a different answer.
I think as laid out, and I know Dr. Stoddard, I'll just say briefly because he and his team were working with the entertainment committee. You're right, the governor had these activities in phase 3. We have not moved to phase 3 as a county based upon our community transmission levels. As we were approaching that, the team did meet with representatives from those respective communities to talk about how to create safety precautions and procedures to put into place. But as Dr. Stoddard just laid out, before those types of provisions could be implemented, we saw our cases start to increase and we had to go in the opposite direction. The hope is that those very same discussions that have been had already to come up with different platforms and procedures can be revisited once we can get the numbers back down, moving in the other direction and see lower rates of community transmission that would allow us to move forward to the next phase. And even in the absence of being able to move forward to a full phase 3, be able to come up with some alternative strategies to be able to implement those programs for those respective industries.
Okay. And this next question sort of goes right in line with that, Dr. Gales. It's hard to look beyond the immediate crisis, but looking towards the spring when we would consider allowing outdoor dining. I guess not allow. When outdoor dining becomes popular again, when the weather sort of shifts, can we consider allowing outdoor performances socially distant at that time? The question is, I don't understand the science of why they would be treated differently, but I think that's something for us to sort of put a pin in and just think about as we get 5-6 months down the line. So,
well, 5-6 months down the line, I think we're going to be hopefully in a very different situation. One in terms of, and this is an apolitical comment, but with a new administration that seems to have more of a blueprint that they expect to put into place in terms of a national strategy to deal with COVID. I think as well as the advent and introduction of a vaccine or different vaccine candidates that making that widely available to folks. I think we're going to be in a very different, hopefully we're in a very different position in the spring. Now, I suspect because even in talking about the presence of a vaccine, given how we laid out that there are different priority groups, it's going to take some time for everybody to get the vaccine. It's not going to be, hey, here's 350 million vials and everybody gets it at once. That it's going to take some months to be able to work through that process. So the expectation is that, yes, the non-medicinal public health guidance, such as wearing face coverings and physical distancing, many of those principles are likely to still be in place. But again, we'd be in a very different situation if, again, we do have a successful vaccine candidate or candidates that we can start getting out providing coverage for folks.
And I would also add the expansion. We within the county are getting our first rapid testing up and running, and I would expect over the coming months that's going to become more readily available, and that will also be a tool that businesses will be able to utilize to potentially do additional events as well, to try and if you were doing a performance, for example, you could do rapid testing of your crew, staff, and attendees on the day of an event, and very likely be able to move forward with that kind of event. And so there are going to be some additional options that will be on the table for us over the next couple months, even potentially even before the full spring. And so we will definitely continue to update our guidelines as the available options to us change.
That would be awesome. And as we wrap up, it looks like there's a question regarding, can we find a better way to notify the public when a new executive order is being issued or reviewed by council? And I also have a text that says using Alert Montgomery to notify residents. So I'm not sure where we are currently in, that particular Alert Montgomery, but it's something we should definitely keep an eye on, because we always want to, I know we always try to make sure we tell as many people as possible, but the more, the better is always welcome.
It's a great suggestion, one that I want to talk to my team about, and we may just be able to create a subgroup that is executive orders, where you just have to go into your Alert Montgomery account, sign up, and click that box, and you'll get those alerts moving forward. I'll talk to my team, and I'll let you all, we can share that in a future meeting. It'll take us a little time because we'll have to get a procedure up and running to, have the notification go out, but we don't do the executive orders often enough where I think that we would have a change before our next meeting next week. So.
All right, you got it. And as I let you all go, there was an anonymous post that said, I just want to say thank you. I'm very happy to live and work in this county. I'm grateful for everything the county is doing to keep us safe. So we will end right there. I want to thank everyone on this call and thank everyone who listened for their time today. It was very, very valuable. Thank you, thank you, thank you, thank you, Dr. Kells, Dr. Stoddard, Sylvia. We definitely appreciate all of your answers and responses. It is not easy, and you did a wonderful job of answering some tough questions, and we appreciate your time. We hope to see you again in the future. Until we do, take care of yourselves and be safe. And once again, take care of yourselves.